Welcome to Adapt NCLEX. This is our Pharmacology Practice Test 20. This video, we're going to focus on basically pediatric drugs that you need to know for the NCLEX and nursing school. Let's get to it. First question, all these questions, I want you to stop the video. We're going to talk about concepts. It's a concept on every question. Stop the video, answer it on your own, and then listen to the way I'm going to approach it and write down the concept so that you can use it for every question. First question, a 5-month-old is prescribed ibuprofen for fever. Which instruction is most important for the parent? Give every 4 hours around the clock. Call the provider to confirm the prescription. Administer on an empty stomach. Alternate with aspirin for better fever control. What do you think? Stop it. Put it in the comment. Let me know your answer for the first question. I trust you're going to answer this question based on concept. And what is the concept is what? How do you answer question? Ibuprofen. That is the key. And 5-month-old. Connect the dot. Why did I give you 5-month-old and ibuprofen? There's a concept associated with it. How do you answer it? Anybody less than 6 months should not get ibuprofen. That's all. Therefore, the most important information the nurse should provide to the parent is give every 4 hours around the clock. I don't think so. The kid is 5 months. Call the provider to confirm the prescription. That is a better choice. Administer on an empty stomach. Ibuprofen should be taken with the fluid. Alternate with aspirin for better fever control. You know aspirin is not good for kids. The best medication is acetaminophen. The concept here of ibuprofen should never be given to a kid less than 6 months. And like I said, all the questions are going to be like this, where I give you the concept. And so that when you see a question, you can apply it without memorizing the question. Ibuprofen should never be given to infant under 6 months. This is a key because their kidney is not developed. First choice, number 2. Which teaching is correct? This you have to know. This, please know it because it's very, very important. Cystic fibrosis patient. Nurse care for a child with cystic fibrosis prescribed pancreatic enzyme. What is the concept? Cystic fibrosis patient, they need pancreatic enzymes because the pancreas does not work. It cannot secrete due to being blocked by the mucoid secretion in the duct. Selected apply. Don't pick everything. Pick those that you're 100% confident using the concept. Therefore, what is number 1 going to say? I'm going to show you what you should pay attention to. Each question, try to analyze it. What is your answer? Put down in the comments. I would like to know. Stop the video and answer it. Let the child chew the enzyme with meals and snack. Give on an empty stomach before meal. Give only if the child ate fatty food. Sprinkle it on applesauce for the child to swallow. Mix it with hot liquid for absorption. Sprinkle it on milk or hot milk for child to swallow. What do you think? I know you get it, but you have to use the concept. It's a selected apply. All the answers sound the same, but there's a way you can answer it. The key, once again, the key, this medication comes as a capsule. Therefore, you should not chew it. You should not crush it. You should swallow it. At the same time, if you want to open it, you can open it and sprinkle it on food. But the food has to be acid. And then you got to swallow it right away with the food. And the answer choice provided, let the child chew, is wrong. You can't chew it. Empty stomach is not good because you need the food to eat with it. Give only if the child eat fatty food is not right. Sprinkle it in applesauce. Applesauce is an acid. And then swallow it. This much is better. Mix it with hot water. No, you can't do that. You will destroy it. Sprinkle it on milk. Milk is a base, and this is also hot. You can't put it together. So acid food can be sprinkled on it, and then you take it right away. So there's only one answer choice here. If you pick more, you get 0. But the key is to use the concept to look at it. This is the hard question. As we go through the case, there's going to be harder and harder and harder. Some will be a little bit easy, but that is the purpose of the test. So stick around so that you can see those variations those questions. Number 3, a nurse cares for a child prescribed amoxicillin, which instruction should be given to the parent. Stop the medication once the fever subsides. Discard the liquid suspension after 14 days. Give with fruit juice to improve absorption. Double the next dose if one is mixed. That is the concept. Like I said, each question, this is NCLEX Pharmacology using Pediatric Pharmacology Review, NCLEX practice questions, questions and answers. What is the problem? Why do I give you amoxicillin? And I say you're giving it to a child. It's an antibiotic. It should be taken what? Based on the prescription. So you should not stop it when the fever subsides. I know you never selected that answer choice. There's a temptation. You're going to put fruit juice. Fruit juice rather make it worse. It tastes really bad with fruit juice. You should know this. Don't give it to them. You should never double the dose if one is mixed. Continue with the prescription given. The key is this. After 14 days, the suspension doesn't work anymore. There's a risk that the parents will continue to give it to them. But at 14 days, the medication doesn't work. The suspension needs to be discarded. Therefore, the right answer is number 2. But that is the concept. Amoxicillin suspension should be discarded after 14 days. And therefore, you should never use it after that time. And that's the right answer. And this is the way you approach the question. Every question, like I say, is a concept. This one is a little bit busy. It's usually dose calculation. But don't worry. There's a lot of ways there. It's just straightforward. Adapt NCLEX got you. Take your pen and paper and see the way I can approach it. Dose calculation. If you need more, I have a bunch of dose calculation on Adapt NCLEX. Which action should the nurse take? So what would you do? A nurse prepared to administer acetaminophen to a child. They give you the weight, 20 kilos for fever. The provider prescribed 250 ml every 8 hours. They give you the safe dose, 10 to 15 milligrams per kilo per dose. That is the safe dose. What does the safe dose mean? How do you answer this kind of question? Underlining. The safe dose means if you have to give the kid, this is the maximum and the minimum you can give it. This is the minimum and this is the maximum, every dose. Therefore, to approach this question, to know, prescribe 250 milligrams every 6 hours, you have to know if the 250 is within this safe range. How do you do that? This means what? 10 to 15 milligrams per kilo per dose. That means every kilogram of the kid, you can give them 10 to 15 milligrams of the acetaminophen. Therefore, if I weigh 20, then you should multiply the 10 by 20, which is what? 200. And the 15 by 20, which is what? 300. Therefore, the safe dose, as you can see, is 200 to 300 milligrams every 6 hours, whatever time was the frequency. Prescribed medication was 250. This is within the safe dose. Therefore, the nurse should not hold the medication. The nurse should not reduce it to the lowest dose. The nurse should not increase it to the highest dose. The nurse should give as prescribed. Calculation of safe dose. If you need more, check out that index. But this is the way we can calculate safe dose prescription. What is your answer? 4 questions. I know you get 4 out of 4. If you don't remember the safe dose, those are the key. This question testing your knowledge, test-taking strategy, and critical thinking. A nurse is administering a medication that is metabolized primarily by the liver. That is the reason why I said by the liver. How do you answer questions? Go for the buzzword. What is the buzzword? By the liver. That means that medication will be metabolized by the liver. In which client should the nurse monitor most closely for adverse reaction? That means you have a bunch of kids and the medication they're going to take is related to the liver. If your liver is not good, you can't use it. Who will you monitor closely? It's straightforward, but requires some critical thinking. Is it 3 months old, 5 months old, 7 months old, 15 months old? Stop the video. I want to know your answer. I know you got it because you watch Adapt English. Put down your answer in the comment section. I would like to know your answer. But this is the key. The liver is immature in kids, less than 6 months. After 6 months, it starts to pick up with maturity. Therefore, who we need to monitor closely, it has to be somebody who is 3 months old. 5 months is also bad, but prioritization, 3 months is the best answer choice we have. And is administered phenytoin to a child with seizures, which finding require priority intervention. Gingival hyperplasia, double vision, skin rash, mild drowsiness. What do you think? I want you to stop the video and let me know. Adapt English when you know what to pick for this answer, because this is always a good medication to know for adult and pediatric. We're focusing on pediatric pharmacology, English practice questions, English questions and answers using this key concept. Phenytoin is an anti-seizure medication. We give it to kids and adults. Both of them can have seizures. There's certain side effects you're supposed to know. It's a sulfur drug. That's number 1. 2, it has a common side effect. Number 2, and that is what? Gingival hyperplasia, double vision, mild drowsiness. You can get rash. There's 2 types of rash, photosensitivity and Stevens-Johnson syndrome. Which one will you prioritize? You don't know what the rash is. What? I never tell you they went out to the sun and get a rash. That is photosensitivity. Therefore, the right answer is number 3. It may be Stevens-Johnson syndrome. That is sepsis. We got to intervene. First thing. How do you treat gingival hyperplasia? Oral care and antibiotic is not a priority. And nurse is preparing to administer medication to a newborn. Which intervention is most important to minimize the risk of drug toxicity? This is the same question we saw. This is the same question we saw 2 questions before. Number 5, newborn. I'm going to give you medication. Which one I should prioritize to minimize toxicity? That means I'm giving a medication to a newborn. What should I do to prevent the newborn from getting sick from it? Shorten the interval between the medication dose, monitor the newborn urine output and kidney function, double check the dose with another nurse before giving, give the medication by the safest route. What do you think? This is critical thinking. I give you the answer already previously. A newborn, what is the key aspect when it comes to safe medication administration? This is the safe medication administration question. What do you think? A newborn, do you shorten? That means you give them more medication in a very short time? Or you monitor their urine output in a kidney? Do you verify the medication with the nurse before you give it? Or you give it through the fastest so they can get to their system quickly? The concept that we talk about, like I said, I gave you the concept in the previous question. That newborn, their kidney and their liver is not matured. Therefore, if it's not matured, before you give them a medication, you got to make sure the kidney is functioning and the liver is also functioning by checking those enzymes. Secondly, if you give them the medication in the shortest time, they can clear it out of the system. The liver and the kidney is responsible for getting drugs out of your system. If they are not matured, you're going to become toxic regarding the medication. Shortening the interval is a bad idea. Checking with another nurse, I know some people will pick it. It's not the wrong answer. But in this prioritization question, I said the most important. This is why prioritization can be difficult, but you got to use strategy and say, think about it. Do I check with the nurse? That means you're okay with their kidney function and liver function not being good. That means you shouldn't pick it. Checking with the nurse is a normal practice, but monitoring their urine output and kidney function before you give them the medication is the most important. Safest route, defeat the purpose that they cannot clear it. You want to give it to them so that they can get it slowly. What do you think is the right answer? I know you got it. Number 2 is the right answer. And this is perfect. And this is reinforcing teaching to parent of a child prescribed Methylphenidate for ADHD, which instruction is the most important. If you're taking the English today or in a nursing school, I want you to know this medication for ADHD. Methylphenidate is a high yield key medication that showed up, keep on showing up whether you like it or not, because the kids A lot of kids are on this medication. You have to know how to teach the parent. What is Methylphenidate? Which instruction is most important? Give at bedtime for best effect. Expect sedation as a common effect. Limit fluid while on the drug. Monitor weight and appetite regularly. This is a medication that is very high yield. What do you think? Methylphenidate is a stimulant. That's the key word and the buzzword and the concept. A stimulant should never be given at bedtime. You're not going to sleep. A stimulant cannot sedate you. You will need some fluid. Therefore, by elimination, weight and appetite, a stimulant always suppresses your appetite. Since it suppresses your appetite, you're not going to eat. And therefore, that is the key. Growth retardation is the key regarding methylphenidate. So we need to know so that we can monitor that. That's the best thing the nurse can teach. A 5-year-old with asthma is prescribed Albuterol inhaler, with side effects should the nurse teach the parent to expect: bradycardia, hyperkalemia, tremor, hypoglycemia. This is a trap question. There are bad problem answer there. You see bad answers over there. There is likelihood that you get trapped by one of them. Go for the buzzword. The buzzword in the question is what? Albuterol. Albuterol is what? Beta agonist. What does beta agonist do? It speed things up. So things goes up, except your potassium. Therefore, if things are going to go up, it's a beta agonist. It's like I'm giving you epinephrine. You're not going to be bradycardia. It's going to cause hypokalemia. It will lead to tremor, and you make your sugar goes up. You see how I approach it. This is test-taking strategy, pharmacology, using concept regarding Albuterol, which is a respiratory drug. And based on that, you can see that the answer choice look like tremor, but the other ones are all traps. Therefore, don't pick it. Number 10, a child with sickle cell is prescribed morphine. Which nursing action is most important? Monitor respiratory status, encourage fluids, monitor urine output, assess for constipation. What do you think? Based on what I've given you, which of this is very, very important? Which of this you should monitor? Which of this you think is very important? Morphine, what does morphine do? It decreases your respiratory drive, and therefore it's a downer. If this is a downer, then what are you going to do? A downer, you need to monitor the kid's respiratory status. Encourage fluid intake is okay because you prevent constipation. Monitor urine output, yes, because you lower your urine output. It causes urinary retention. So you're going to assess constipation. But the most important thing you should do is checking for your respiratory status. And this is the way you can know the thing, but sometimes you got to apply it. Number 11, a toddler ingests iron supplement accidentally. Which intervention should the nurse anticipate? What do you think? Number 11. We are 5 questions away. 10 questions pass. What was your answer? I would like to know. Let me know your score. Put your score down. Toddler ingests iron supplement accidentally. Which intervention should the nurse anticipate? Every time you're looking for questions regarding pediatric accidental injection, always go for the buzzword. Iron, accidentally, intervention. What would you do? Don't pick lavage. Never pick lavage. Never pick lavage. It's outdated. It causes more aspiration and the kid's in trouble. If there's activated charcoal there, you got to make sure it's within 1 hour. Therefore, based on that, 1 is gone. 3, 4, and 2, 3, and 4. What do you think? Administer what? Deferoxamine, which is an antidote. IV calcium gluconate, which is also an antidote. Hemodialysis, which is also treatment for something. Hemodialysis takes a long time. Test taking strategy. Don't pick number 4. There's no need you should. It's a what? Anticipate. The nurse should do it right now. Accidental injection, we got to do something right now. You're left with 2 and 3. Calcium gluconate is not used for iron. Therefore, number 2 is your right answer. This is the key. All the questions that you see, I'm using the same strategy. This is the question. I want you to write it down. It's a test-taking strategy. Everybody knows this about digoxin, but there's the way they can frame the question, you can get it wrong. This is test-taking strategy. Write this down. And next, administer digoxin to a 3-year-old. The medication is already given. Which finding require immediate intervention? That means something is killing the patient. We got to stop now. Vomiting, bradycardia, fatigue, anorexia. If you watch some of my video, I've told you digoxin, the number 1 toxicity sign is a sign. Number 1 sign you should be looking for when the patient is digoxin is GI symptoms. But after that, when the toxicity already occurred, then you look at other conditions. The bad one is your heart. That is the way to approach it. At the same time, I have vomiting and anorexia. That tells you there's 2 GI problems. It should never be your answer choice. 1 and 4 should never be your answer choice because they are the same GI symptoms. Now you're left with brady and fatigue. I will choose bradycardia. And this is the way I explain it. Bradycardia means the medication has already finished you already. Now, that is the red flag. If you don't do anything, you're going to die. The yellow sign means, which is GI. When you see it, you should not wait until you get to red. And how do you know? They are asking you about getting to red. Immediate intervention. If I see bradycardia, the kid is dead. Therefore, I pick that one. This is a follow-up. And look at the way the question is framed. A nurse is caring for a 3-year-old child receiving digoxin for heart failure. The same thing. Which finding should the nurse recognize as a sign of toxicity? The sign of toxicity, they're looking for early sign. That means this is a sign of toxicity. When you have bradycardia, it's not a sign of toxicity anymore. The medication has damaged you. But when I see GI symptoms, I know this is the beginning. Your body is telling you yellow flag is flagging, is flagging. Same thing. I see bradycardia and heart block is the same thing. I'm not going to pick the 2. Fatigue, therefore vomiting. And you see the way I approach them, they are the same question, but the answers are different. GI symptoms are first signs of toxicity. Therefore, the sign of toxicity in this situation, I'm going for the GI symptoms. 2 more. And then prepared to give an IM medication to a 2-month-old. Know this, know this, know this, because they ask all the time. They will give you a diagram and you have to point it. Or they will ask you, what is the name of the location? IM medication on the kid, less than 6 months. There's a specific location, which I know you know. Which I know you know. If you need, I have a lot of paid videos that you can watch it on my website, on my channel. Which side is appropriate? Deltoid, they don't have a lot of shoulder. Ventral gluteus, their gluteus is not that big. Their thigh is the safest. There's less nerve, there's less vessel. Therefore, I'm going to vastus lateralis, less than 12 months. This is it at the lateral portion of their thigh. This is adductor class. 1 more question. Number 15, last question. English practice question, focusing on pediatric pharmacology, using expert answers and explanation. Child is prescribed with aspirin for Kawasaki disease. Yes, we give you aspirin for Kawasaki disease because we want to prevent cardiac issue. Therefore, what complication should the nurse be concerned about? Aspirin, does it cause bleeding, cause constipation, drowsiness, allergic rash, or Raynaud's syndrome? What do you think? Put down your answer in the comment and let me know your score, 15 out of 15. But you know, aspirin is antiplatelet. There's going to be some bleeding. There's no constipation associated with it. There's no drowsiness associated with it. There's no allergic reaction you should be concerned about. Raynaud's syndrome is very important. Kawasaki is a UR symptoms. You should never give them aspirin. But why do we give them aspirin then? You don't want the kid to have cardiac aneurysm or die from MI. Raynaud's syndrome, the parent can watch them. Therefore, those are the things the nurse should be concerned about. 15th question, English practice question. based on pediatric pharmacology, pharmacology practice test. Thank you for watching. If you need more, follow the series. This is practice test number 20. Take care of yourself. Subscribe to Adapt NCLEX for more content like that. Good luck in your exams and nursing school.